Hello, my name is Manuel Izquierdo. I am a pulmonologist with Prisma Health. Today we're going to be talking about cystic fibrosis. What are some of the risks and challenges people with cystic fibrosis face? I would say some of the biggest risks that patients with cystic fibrosis face has to do with respiratory failure. Patients with cystic fibrosis have to commit to complicated regimens that are both time-consuming and difficult. These airway regimens can take anywhere from 30 minutes to an hour and are prescribed 2 to 4 times a day. This is very difficult for patients to navigate while trying to have a normal daily life. Additionally, things that patients with cystic fibrosis have to overcome is problems with their bowel habits. Pancreatic insufficiency causes thickened stool burden that is difficult for patients to sometimes deal with. This is why taking your pancreatic enzymes on a daily basis is paramount and important for these patients. How can people with cystic fibrosis best manage their conditions? People with cystic fibrosis can best manage their conditions by joining a cystic fibrosis center. Cystic fibrosis centers are built to meet the patient's complex medical conditions and needs that are common with cystic fibrosis. This includes having a pulmonologist, dietitian, and even a social worker to help with the patient's everyday needs. Can people with cystic fibrosis have children? Men with CF are oftentimes infertile. The rates range from 90 to 95%. This is usually because of an anatomical variant known as the congenital absence of the vas deferens. Female infertility rates range from 35 to 50%. This is for a different reason though. Females often have thickened cervical mucosa and even hormonal imbalances that contribute to their infertility. Oftentimes, females will find that after they begin modulator therapy, they are able to have children. Is exercise okay for patients with CF? Yes, absolutely. Patients with CF benefit from exercise, not just for the normal cardiovascular effects, but also because it helps with airway clearance as well. The vibrations and movement and increased respiratory rate that patients often have to undergo when exercising is actually beneficial for their bronchiectasis and chronic pulmonary conditions. How can you best support a loved one with cystic fibrosis? I think you can best support a loved one with cystic fibrosis by caring for them and being there in times of need. Patients with cystic fibrosis deal with difficulties every single day, ranging from having to do a complex pulmonary hygiene to dealing with an upset stomach from bowel problems. Encouraging them to join a CF care center will help with all of these and really support your loved one.